Of course, the virus will still be circulating amongst the general population. And what's essential is that we minimize another peak happening.
You must stay at home.
Whatever it takes.
We will beat the coronavirus, and we will beat it together.
In just a few months, the coronavirus has killed thousands, crippled the economy, left us freedom-loving Brits under virtual house arrest, and right now, there doesn't really look like there is an end in sight. So when the lockdown measures are finally lifted, how are we going to avoid these potentially more deadly second and third waves of COVID-19? Well, let me bring in Britain's most trusted medic, Dr Hilary Jones. Hills, there's lots of talk about the government's concern of future waves of coronavirus if we come out of lockdown too quickly. How can we avoid this?
Hi, Dan. Yeah, it's a question that is bothering a lot of people. When we come out of lockdown, it's likely to be in a phased and staged way so that those people who are least vulnerable go back to their normal activities. Of course, the virus will still be circulating amongst the general population. Those people who've been in lockdown will not be immune. Those people who've been key workers and going about their essential work will have been exposed, so the virus will still be there. And what's essential is that we minimize another peak happening by people getting together, going about their normal business as we did before. So mass gatherings, things like sports occasions, football matches, rugby matches, pop concerts, they would be events that would just increase the chance of another peak. So what we have to do is to practice social distancing still, open up small businesses first where not many people gather in the same place, where the vulnerable are most protected still. And that situation could go on for some time. And another strong arm of the policy would be to test people who are symptomatic, so we can isolate them if they do carry the virus, and that we contact trace the people who've been in touch with them so that we can isolate them too. And by doing this, we can be much more scientific about who to isolate and who to allow to come back into their normal activities. And this will protect the society as much as possible from big secondary or tertiary waves of the pandemic.
Now, I know it's become quite a dirty phrase amongst the UK government, but isn't this where the idea of herd immunity comes in, Dr Hilary? Because that's why Sweden, for example, has taken a different approach. And while their death toll is a little bit higher than equivalent countries right now, their experts believe in the future their death toll will be much lower and they will avoid these future waves because the population, which hasn't been under these draconian measures like we are here, has built up a degree of immunity.
Well, it's an interesting thought that their herd immunity will increase, but at what cost? We're currently seeing a big surge in the number of elderly people in care homes in Sweden who are losing their lives as a result of this rather more liberal attitude to controlling the virus in Sweden. Their death rate is much higher than their neighbours in Norway or Finland. And their scientific experts have been increasingly criticised about their liberal idea of lockdown, leaving it to people's individual responsibility to distance themselves in bars and restaurants. And currently they're seeing a surge in cases. They have a much smaller population than we do in the UK, and yet their numbers are increasing. So I think we'll only be able to tell whether Sweden's scientific advice was better than ours in retrospect. We've compared ourselves to all sorts of countries that actually at one point seemed to be doing all right, only to then suffer consequences of their policies later on. So no country is going to get this absolutely right. No country is going to be inviolable, if you like, and free of this virus. Everyone's going to suffer, but to what extent will depend on the policies that are put in place. And we can only compare ourselves to other countries down the line.
Your questions to Dr. Hilary can come in via hashtag, actually, on any social media platform, hashtag Ask Dr Hilary. And we've got one here to kick off from Kevin McElroy, who says, I'm furloughed off work. I've been told I'm vulnerable, so I can't go anywhere. How will I know when I can go back to work? And does the whole country have to be tested first before we all go?
We're never going to be able to test the whole country. We'll never have 64 million tests. And even if we did, those tests would take years to go through the labs and get results for. So the answer is you're more vulnerable. You're going to be more vulnerable for some considerable time. What I think is important is that we minimize the transmission of the virus amongst the wider population. When we've got the transmission of the virus under control and more people come out and start their normal activities and their normal work again, and we're seeing far less cases, then your vulnerability will decrease, whether you've got pre-existing conditions or not. But I suspect this virus will be coming around from time to time in little sporadic outbreaks, if you like, for a while. And I think those vulnerable just have to be more protected and a bit more vigilant than they have been in the past, and probably for some time. So difficult to say when, but they're going to be vulnerable for at least, I would think, 18 months to 2 years, or until we have a vaccine.
Our next question is from Nikki, who asks, what happens to those people we are shielding after lockdown?
Well, the shielding people are those people who have conditions which make them particularly prone to the consequences of COVID-19. For example, someone who's had an organ transplant and is on strong immunosuppressants. If their immune system is suppressed, which it has to be to prevent organ rejection, clearly you're opening up the opportunity for something as virulent as COVID-19 to have serious consequences if they were exposed to it. So those people, other people with cancers, people having chemotherapy, they're in the most at-risk group, and they're going to be vulnerable for some considerable time. There is no easy way around this. Until we have a vaccine, which is 100% effective, those people are going to be more vulnerable. It's a sad fact of life, but it is important to know that so they can protect themselves and stay safe.
Question from Michael Bedford, who's actually in the same spot as me, Dr. Hilary. He says, I believe I have caught and recovered from COVID-19. Does this mean I'm immune now and can go back to work? Also, can I get tested if I've had the virus and recovered to enable me to go back to work? I'm self-employed, so I need to.
Yeah, a lot of people think they have probably had COVID-19 to a moderate degree and have now recovered and are wondering whether they're immune. And that's completely understandable. It would be lovely to think that those people, had they had COVID-19, would be immune. But they don't know they've had it because they weren't able to get a test. And there is currently no approved antibody test, even with a CE mark, anywhere in the world that I know of, which is accurate enough to tell you whether you are now immune or not. And I think it's really important that people realize that the tests that are being offered, the antibody tests that are being offered, have not been proven, they're not approved of, and they could do more harm than good by telling you that you're immune when you're not, and vice versa. So that's my word of warning to them.
Cheryl Haig asks, why is the pneumonia vaccine not used to help with the pneumonia resulting from COVID-19?
Right, so vaccines that we use for certain diseases are specific to those diseases. If we give you a vaccine to protect you against measles, it's not going to protect you against mumps. So if we give you the pneumococcal vaccine, which protects you against a bacteria called pneumococcus, it's going to protect you against that, but it doesn't protect you against COVID-19. Vaccines are disease specific, and I'm afraid whilst it might protect you from a secondary bacterial infection with pneumococcus, should you be unfortunate to get that after COVID-19, it doesn't protect you against COVID-19, only the pneumococcal infection.
Robin Paxton asks, the full-time carer that looks after my 99-year-old mother is returning from a period of leave. Is it possible for her to be tested for coronavirus before she returns to my mother's house?
Eventually, we hope that that will happen. The government are promising that when they get 100,000 tests a day, that more care workers, whether they work in domiciliary situations or in care homes, will all be tested. Currently, I'm not sure that those tests are available. They are being promised, and hopefully we'll have them soon. But I would ask the care worker, what was the reason she was on leave? Hopefully she wasn't self-isolating with symptoms. But even if she was, if she's better now, there's no way of telling whether she has had COVID-19 or currently has COVID-19. But she's a care worker. She is a key worker. We want her to be at work, but also she needs to try to socially distance as much as possible from her charges, her patients, even though that may not be possible because obviously carers have to get close if they're bathing people, bathing them, if they're changing their clothes, dressing them, feeding them. It's almost impossible to socially distance. And that's why we need PPE for those people and why we need testing.
Great stuff. Question here has been sent in. Hello to Kerry McLaughlin.
Hi, Dr. Hilary. My mother-in-law is 84. If we come out of lockdown, when would it be safe for my wife and I to visit her?
Okay, Kerry, good question. A lot of people are asking that too. The answer is that, as I say, the virus isn't going to go away just because the current lockdown is phased out. You want to go and see your 84-year-old mother. Of course, I understand that. And she'd love to see you too. But every contact between human beings currently is a potential risk for viral transmission. Provided you're asymptomatic, provided you haven't got any symptoms yourself, it seems reasonable further down the line when we're seeing fewer cases that you visit your elderly mum. But again, ideally, you would be 2 meters apart at all times. Probably one of you would go at a time. You might even want to meet outside rather than in the house. And I think that's the way visiting in the future that's what it'll look like to start with. So rather than a big family gathering, it'll be just one person or 2 people at the most, keeping their distance, saying hi, giving themselves a virtual hug and kiss, but not actually getting too physically close, because for a while, there's still going to be a risk.
Thank you so much for your question, Kerry. Thank you so much, Dr. Hilary. And thank you so much to you for contributing and being part of the show. And I'm sure you probably have lots of things that you want to ask Dr. Hilary right now, and you can. All you have to do is use the hashtag Ask Dr Hilary on any social media platform. You can send in your video like Kerry did, or you can go to thesun.co.uk/Dr Hilary, or go to the Talk Radio website, talkradio.co.uk, and submit your question there as well. We will be back tomorrow for another edition of Ask Dr Hilary Coronavirus Explained.